Hello again, everyone. My name is Marty Guthmiller. I'm the CEO at Orange City Area Health System, and I'm bringing to you today the 17th edition of our COVID-19 community briefing. It's been a couple days. There's been a lot of activity, particularly over the weekend, and so I'm here to give you some information as best as I can. First of all, the normal scoreboard that we've been tracking internally. And that's not the most important thing I'm going to talk about today, as some of you probably already know about a few more cases being determined this weekend. But I want to start consistently with giving you our local scoreboard. We've done 89 tests now, 89, and 7 of those tests have been positive. 82 of those tests have been negative. Something that we really haven't talked about yet much, though, is the severity of illness of these people. To the best of my knowledge, we've had 4 of those 7 positives that have actually had some degree of hospitalization. I believe 1 was pretty much just overnight, 2 were really for the duration of their disease, and 1 patient was transferred out in a non-emergent way to Sioux Falls. So the level of hospitalizations is 4 out of the 7 positives that we had. The bigger story this weekend probably is the number of cases that Sioux County has announced. Sioux County is now up to 86 positives. I believe as of Friday, it was 40. And so there were 46 positives announced over the weekend. According to CHP, all 46 of these positives are self-isolating. I know that CHP has, or Public Health, has contacted all of these individuals and knows that they are self-isolating. I did check into also, by the way, of these 86 positives in Sioux County, how many might have required hospitalizations. And my understanding is that to our knowledge, there's 0 of those 86 have required hospitalizations. So even though we've had a little bit of an uptick in the number of cases, relatively speaking, they appear to be minor. And that's a good thing, obviously, from a number of perspectives. One of the things that I wanted to talk about today is that this is before I do that, I want to go back to the county situation, because I don't want to just let it go that there were 46 new positives this weekend and not explain a little bit why or how. And a lot of this stuff is proprietary. It's not public information, but I would point you to Community Health Partners Facebook page. I do have the release here in my hands that was posted. So you can check that out on their Facebook page, but I'm going to read part of it to you right now as well. More than 400 tests were done recently at 2 sites in Northwest Iowa after a local business asked for assistance with testing to help prevent, detect, and mitigate the spread of COVID-19. This is called surveillance testing, and it can detect the virus even in people who don't have any symptoms. Many people who get COVID-19 will have no or only mild to moderate symptoms and may not know that they are ill. Surveillance testing helps individuals so that they can isolate themselves, and employers can exclude them from work and sanitize workspaces. Targeted surveillance testing at a business where there are confirmed cases and likely exposures has increased, but not exclusively increased, the number of positive cases in Sioux County. This is an important part here. Positive tests are reported based on the individual's county of residence. As more testing is done through Test Iowa, surveillance testing, and healthcare providers, we can expect to see more positive cases in Iowa and in Sioux County. So again, go back, check the Facebook page for Community Health Partners for CHP. This posting and a few more details is going to be on there. but the Iowa Department of Public Health can only release the name of a business if they determine an outbreak has occurred, and the state medical director determines such disclosure is necessary to protect the public health. And so that's as far as we can go today with talking about that. But I thought it merited a little deeper dive since we did have the 46 new cases this weekend. Now I will transition to what I wanted to visit about earlier as well. I think this is a really good time to control what we can control. I know I'm reaching the end of my patience in terms of self-isolation and all that, and psychologically I can tell that it is taking a toll on myself and others around me, and those here at the health system as well. So one of the things that I think Dr. Donlin talked about is to control the things that we can control. One of the things that, remember when we talked about flattening the curve, and we haven't talked about that in a while, but is a big topic earlier on. What flattening the curve means is that, what the flattening the curve does not mean is that the disease is just going to go away. Flattening the curve was a strategy that worked, by the way, with the social distancing measures we put in place, but was really a theory or a tactic to delay the number of infections that happen, in part so that it didn't overwhelm the health system, but also so that it could get closer to treatment and closer ultimately to a vaccine. As we've mentioned before, it is very likely that many, if not all of us, will eventually get COVID-19 at some point. But we wanted to make sure we have PPE available, that we have resources available, and that we get closer to those treatments and vaccinations. By controlling what we can control, what I'm talking about is, I'm sure many of you have heard that the number of comorbidities or the number of other illnesses or conditions that you might have greatly affect the impact of COVID-19 if and when you are infected. Some of the things that we can do to address these underlying conditions fall within the realm of controlling what we can control. Those are things like vaccinations. My understanding is the country, and maybe a little bit more larger regionally, we're beginning to fall behind in childhood vaccinations. Let's keep those vaccinations as current as we can. To make sure that blood sugars are being maintained appropriately, diabetes management is controlled. Maybe it's time to seek some professional advice into how you're controlling your blood sugars. Make sure they're up to speed. Blood pressures, the same thing. Hypertension is one of those issues with COVID-19 that if you have high blood pressure, that's particularly problematic. And so let's deal with that proactively at this point. Make sure that your labs are up to date in terms of the various checkpoints that labs create, and make sure you have your wellness exams, you're up to date with those kinds of things. Mammographies, colonoscopies, obesity. Make sure that you're dealing with, if you are overweight and we need to deal with that, let's deal with that. And let's prepare ourselves as best we can for the likelihood that we will eventually contract the disease. Anti-inflammatories are another thing that are out there, and there are various ways that you can reduce inflammatory natures, whether that's diet or otherwise. And again, I'm not here to give medical advice today, but think about and put into your regimen things that maybe can lower or employ the anti-inflammatory symptoms or mechanics of how your body works. So those are a couple things that I think we could all work on to control what we can control. Finally, I'd just like to close by saying nobody has all the answers. There's a tremendous amount of information that we simply don't have, that we don't know about this disease, about this virus. And that puts further stress on all of us, quite frankly, because we hear about this and we hear about that, and masking is a good thing. Masking is not a good thing. Social distancing should be 6 feet, then it should be 10 feet, then it should be 20 feet, then it should be 100 people, then 50 people, then 10 people. Things keep changing. That's because simply nobody has all of the answers. Now, we can all apply common sense filters to this, and that's what we've talked about before. It makes sense to think, and just wearing a mask in and of itself doesn't make anybody bulletproof. It doesn't make anybody, it should not give somebody too much confidence in being out in the public. Still, social distance and practice those kinds of measures. We have great leadership. We have great caregivers in our county. And I think we need to rely on that, trust those people. There's an awful lot of unnecessary fear and doubt casting that can happen on social media. Questions and concerns should be presented to those people, those professionals that can address them, can answer them as best they can, and support their answers with some kind of clinical data if and when available. So again, tremendous amount of information that is not known. We're trying to do our best. Keep doing the social distancing. Keep utilizing grace as you interact with people who may not be wearing a mask or who wear a mask. And it's kind of like there is not really a win-win scenario out there right now. So again, trust the leadership, trust the caregivers that are providing the care, and let's all work extra hard to give each other grace during these difficult times. Thank you again for joining us today. Hang in there, stay vigilant, stay strong, and stay healthy. Thank you.